we use the term evidence-based medicine to refer to those protocols and guidelines that are the result of a careful analysis of the evidence of what patterns of treatment are the most effective in caring for a patient with a certain disease. So it's, in a sense, the first round of effectiveness research, and the next step is comparative effectiveness. In other words, if you use these medications in this situation, is that better or worse than using either other medications or a surgical intervention? Advances in medicine have come through new scientific discoveries about the basic biology of how bodies grow and how immune systems work and all of those kinds of things. There's now a new opportunity for advances in health quality just by understanding how we use what we know. So we're beginning to look more holistically at a person. And when we talk about patient-centered care, we're talking about a more holistic approach to that patient, and that means in an era of specialty care that all the doctors associated with that person have to understand what one another are doing and thinking so that they can take a holistic approach to the care of that patient. So what used to be you go to the doctor, he takes care of you, is now you go to this doctor and your integrated team takes care of you because they're in good contact, and that team is increasingly including a seasoned and capable nurse manager or care manager, telemedicine. I mean, some of these systems now are very sophisticated in doing remote monitoring, but also telemedicine. So the patient can actually see the doctor, though they're far too far apart for that elderly person to make the trip. So the possibilities now, just by using what we know in a more consistent, planful, evidence-based manner, can actually improve the quality of America's health dramatically. You can't get to this more integrated, holistic approach to health without Health IT, because there are so many specialists, because there is so much need for remote contact and not just wait until people get to the doctor's office. So Health IT is essential to just using what we know. And now that we know so much, we also need to be able to use Health IT to do what's called comparative effectiveness studies, to compare what's the patient outcome if you use this approach versus that approach. There have been studies in the past that have maintained, for example, that surgery, because it has possibilities of unintended complications, is used far more frequently than it should be used. That there are other ways of dealing with many things that have, through which the patient is less exposed to infection or to complications or to errors or whatever. So it is important to know that as people are living longer and we have more frail elderly, but living really good quality of lives as long as their frailty is understood, you really don't want to expose that kind of patient to a course of care that may wonderfully address the particular immediate problem, but in the long run may be bad for their health. So comparative effectiveness research is sort of the next frontier, but quality measurement is still a challenge, effectiveness issues are still a challenge, and then comparative effectiveness is kind of the next horizon. This is a very dynamic, interesting, exciting time with extraordinary potential, because health information technology gives us the same kind of power to understand the consequences of what we do and our new opportunities to do things that it has given to every other sector of the economy where it has been broadly and deeply adopted. It's the building block. It's the beginning of a system that will provide enormously better health, wellness, and prevention to America, as well as management of chronic or severe illness, and will enable us at a cost we can afford to assure that all Americans have access to high quality and affordable health care.